According to UNICEF, mothers who get coronavirus shortly before giving birth and begin breastfeeding, and those who become infected while breastfeeding will produce immune factors or antibodies in their milk to protect their baby and enhance the baby's own immune responses. This means that continuing to breastfeed is the best way to fight the virus and protect your baby. Speaking to Today on One, Ben Schernick, the director of NAFSAN, said that the COVID-19 virus has not been found in breast milk, and all mothers who test positive for the virus are advised to continue breastfeeding while practicing good hygiene.
It's really important that we really breastfeed 6 months exclusively. That means nothing else but breast milk for the first 6 months of a baby's life, and then to ideally continue for about 2 years. The only thing maybe that breastfeeding women should know is to really make sure you have enough folic acids and iron, and also that you should continue breastfeeding even if you're tested positive, because COVID will not transmit to your baby's breast, and the baby gets your immune system through the breast milk. So that is strengthening the baby's immune system in the best way possible, is to really continue breastfeeding as long as you can. And to strengthen your immune system, there's a couple of things you can do. So what you can do is really to eat a variety of food, especially vegetables, fruits, drinking lots of water, exercises, going to the sun for getting your vitamin D. That is really crucial. The things you can avoid and actually save you money is to really reduce alcohol, either no or 1 drink a day. Sugar, to definitely reduce the sugar intake, less salt, less oil.
For many communities facing high levels of acute food insecurity, permaculture backyard gardening can offer ways for vulnerable communities to meet their daily food needs, especially for breastfeeding women. Donovan Wagner, the director of Eloolo Permaculture Initiative, spoke about the urban gardening project, which handed over seeds, gardening tools, trees and nutrition training materials to residents of Windhoek's informal settlements.
The purpose of the handover of tools and seeds and training material is really to take this project one step further and to upscale it into the other regions that the Czech Dweller Federation is active. So during this project we worked with 7 mentees, gardening mentees, and they are now sufficiently equipped to really go out there and work in their communities, but also go into these other communities throughout the country. And the tools and the seeds are obviously essential to create new gardens, and are very much part of taking out the message of NAFSAN, of food and nutrition security out there through our mentees that have been trained during this project.
According to experts, no foods or dietary supplements can prevent people from being infected with COVID-19. However, maintaining a healthy diet is still an important part of supporting a strong immune system, which the body needs to fight the virus. Schernick also mentioned that, according to research, nutrition deficiencies, especially for breastfeeding women, can impact the country's gross domestic product by up to 16% if children are stunted due to poor nutrition in the first 1,000 days of their life.